The head of human resources and management, who is standing in for the Honourable Federal Commissioner. Honourable Federal Commissioner.
Thank you very much. Thank you. Before we go into the speech of the Honourable Federal Commissioner, I think it's proper we quickly introduce ourselves. Some of you that we are seeing and the media will be present. So without wasting time, Paul with the camera, introduce yourself.
Good afternoon.
Thank you.
Paul.
Okay.
The photographer.
Okay.
Your own photographer.
You're welcome, sir. You're welcome, sir.
Good afternoon, everybody. My name is Kupchi. I write for People's Daily, but in this program, I represent the government.
You're welcome, sir.
James Ibechi is my name. I'm standing for Ibechi.com and Quantum News.
You're welcome. Not you, sir.
Good afternoon.
Good afternoon. Okay. You're welcome, sir. So, gentlemen of the press, with you here are the management staff of the National Population Commission. Permit me to quickly introduce each and every one of them here present. The man that introduced me is a seasoned professional. In fact, he wears two caps. One as the statistics guru of NPC Benue State, and another one equally important as the public relations image of the organization here in Benue State. I'm talking about publicity. His name is none other than Pastor Ben Imande Oyina. You all know him.
Sir. Welcome.
Next to our very humble pastor is Mr. Shimai Phillips. I'm sure you guys, some of you that are regular here will be seeing him for the first time. But I can assure you that he's a regular face this moment going forward. He's a very senior officer with the National Population Commission here in Benue State. And then the young man sitting is sandwiched between James Ibechi and my dear pastor is Mr. Jackson Ode. Mr. Jackson Ode is our ICT boss. You're welcome, sir. Also note that one of us just stepped out. I'm sure we all know him. Is Mr. Tena Venda. Tena Venda is a technical assistant to the commissioner and our logistics head. You all know him. So I'm introducing him in essential. Having said that, gentlemen of the press, today is a very uncomfortable day in the National Population Commission, Benue State. More so that in the last 72 hours, we lost our head, Mr. Negi Christopher Takum. Somebody you all know. He died on Sunday in the morning. So here we are mourning, but as you know, the work must go on. That is why you saw initially we asked for this meeting by 11 a.m. today. Then we called to cancel the press conference entirely and then call again to shift it from 11 a.m. to 1 p.m. today. That line alone tells you that somebody who is a bit unstable. Actually, the commission in Benue State is quite wavering. You know how important our director is to us. So even as we mourn him, like I said, work must go on. So I crave your indulgence that this meeting that we are having, this press conference, will be as solemn as it is now. We have all stood and given him a 1 minute silence in prayer. Thank you very much. Having said that, I bring you greetings from the Honourable Federal Commissioner, National Population Commission, Benue State, Barrister Mrs Patricia Kupchi-Iyanya. She is unavoidably absent, but before she left, she has written a speech. She has put her thoughts on paper, and she has asked me to deliver her thoughts to you. Like I tell you, in the mood we are, I am going to deliver her thoughts to you verbatim. So what I'm reading, what you're going to hear is the voice of Mr. Onah Adeyi, but the vision and the idea of our Honourable Federal Commissioner, Barrister Mrs. Patricia Kupchi. Once more, you are welcome. Thank you. And it's titled the speech for the 2024 Nigeria Verbal and Social Autopsy VASA Study Press Conference. Distinguished members of the press, esteemed partners, traditional rulers, community stakeholders, and citizens of Benue State. It is my honor to address you today as we launch an important health initiative that will have a lasting impact on the well-being of mothers and children across our dear state and the entire nation. We are here to introduce the 2024 Nigeria Verbal and Social Autopsy VASA study, a crucial survey designed to provide insights into causes of under 5 and maternal death in our communities. The National Population Commission, in collaboration with the Federal Ministry of Health, is implementing this nationwide study. This round of VASA study builds on previous efforts from 2014 and 2019, which provides valuable information that help shape health policies and interventions aimed at reducing preventable deaths. The study is a follow-up to the 2023-2024 Nigerian Demographic and Health Survey that was concluded in May this year. We will be going back to the NDHS households to ask for information that will help government understand and plan to address the biomedical and social causes of death of children under age 5 and for mothers of reproductive age. In Benue State, we have benefited from the strong collaboration between the National Population Commission and the Federal Ministry of Health and our valued state partners to successfully implement health-related projects. In the past, we are confident that this collaboration will once again ensure success for the VASA study. This study will collect essential data on both maternal and child mortality, focusing on the social and health-related factors that contribute to these tragic losses. The information will empower decision makers to address the underlying issues that lead to these deaths and will ultimately inform policies aimed at improving maternal and child health in the state and beyond. Field work for the study will be conducted by selected communities throughout the state between the 4th of November to the 15th of December 2024. Our trained data collectors will visit households to conduct interviews with family members, gathering information that will help us understand the circumstances surrounding maternal and child deaths. This sensitive but essential process requires the cooperation and support of every individual and communities. We recognize the vital role that traditional and community leaders play in mobilizing community support and facilitating the smooth conduct of activities like the VASA study. We call on our revered leaders to lend their voices in support of this study, encouraging their communities to welcome the interviewers and participants fully in the process. Your leadership is invaluable to ensuring that this study is well received and that the information gathered reflects the experiences and challenges within our communities. Additionally, we urge the public to cooperate with our interviewers. They are here to listen, gather, and document our experiences with the utmost respect and confidentiality. In sharing our experiences and welcoming our data collectors team, we are contributing directly to a project aimed at preventing unnecessary issues in our community and securing a healthier future for our family. The collaboration and support of every resident of our dear state is crucial for VASA study. We ask that you receive our data collectors with understanding and kindness, and that you actively participate by sharing the important details. These important details that will help us address the issues of maternal and child health. In closing, I would like to thank all of our partners, including the state government and the ministries, for their unwavering support and commitment to the success of this study. To our field teams, thank you for your dedication to this important work. And to our communities and traditional leaders, we are grateful for your guidance and involvement. Together, let us make the 2024 Nigeria VASA study a success in Benue State. By supporting and participating in this study, we are all contributing to a brighter and healthier future for our community and our country. Thank you.
Okay.
Like I told you, this speech is strictly from my Honourable Federal Commissioner. I didn't add any word, neither did I remove anyone that he wrote. So we'll quickly pause for one or two reactions before we put this press conference to a close. Thank you.
Just like you said, we'll be very brief about that. Discussions, questions, and comments. Now, if you look at the speech that has just been delivered, on the first page, we have to know the meaning of VASA. VASA is a survey designed to provide insights into causes of under 5 and maternal death. Deaths that occur to women and then children under 5. This study is for that purpose. That is the first paragraph of the speech. In the second paragraph, it will help shape health policies and interventions. That is what the study will help do, aimed at reducing preventable deaths. On the same paragraph, you are still finding it will help government to understand and plan to address biomedical and social causes of death for children under 5 and for women of reproductive age. The last paragraph on that page is saying that the study will collect essential data on both maternal and child mortality. What kills women? What kills children under 5? So these are the key things you will find. On the second page, another key thing you will find is that this will gather information that will help us to understand the circumstances surrounding maternal and child death. It's the same thing we are speaking about. Second to last paragraph of that page, page 2, that you are contributing directly to a project, even the media, that is aimed at preventing unnecessary losses in our communities. And so the last paragraph, we are asking you to receive our data collectors. You media are appealing to people to please accept our data collectors in sharing important details that will help address these issues we have mentioned earlier. I think the last page, in summary, is also saying the same thing, that the Commission is thanking you for partnering over the years. The media here, is it Radio Benue, is it Brothers, is it Ibechi? You have all partnered. We partner again with us in this exercise. I think that is what we have as a summary.
Thank you very much.
A question or two, like you said, if there are.
Thank you very much.
Somebody else.
Yeah.
The floor.
You have given us a brief of what VASA is all about. Gathering information for the cost of national debt and debt on that side. And you said there were interviewers to go out and gather this information. What you know precisely, what should they be asking households as they go on the courses? Why there's high rates of age and maternal death? What do the interviewers asking each household when they go out? What's more specific questions? The areas that they're going to ask the households.
Okay. Thank you very much. Another question, because I want to take them all at once. Where do you want, what specific questions you think the interviewers will pose to the communities as why this thing is happening? Does anybody have another question? Okay. So thank you very much. If you listen to the speech, we are looking for causes of maternity death rates of under 5 and the maternal death. Now, you will know that as a journalist, anybody that goes out seeking such survey will be asking the kind of meals they take, the kind of water, what is even their educational level, how aware about immunizations and the like, childhood diseases, what do they take at, what medication do they take at pregnancy, which clinic, which hospital do they go to deliver. Those are the kind of questions we'll be posting to them. And with those questions, you can find exactly why there is this high death rate under 5 and maternal deaths. Thank you.
I think that's adequately addressed.